Welcome to our healthcare panel. Tonight, we have 4 panelists that I'd like to introduce to all of you. We have Angela Brown from Cassia. We have Rob Brock from Boston Scientific. We have Anila Idani from Habit Aware, and we've got Christy Moline from Bethel University. My name is Molly Wickham, and I'm going to be your moderator tonight. And we've got Judy Jones, who is here today as well, providing technical support.
And I guess to continue to just plug healthcare, as we've talked about, to me, what I love about healthcare is that impact piece, the making a difference in people's lives. And that's one of the themes that I've heard through all of us. And I happen to be sitting here in my basement and I'm looking at our ping pong table and I'm like, I could manufacture ping pong tables, and that's great because people like to play ping pong, but will someone's life really be changed if they don't ever get to play ping pong? Probably not. And yet in the healthcare world, people are in that space because they have a real need. And as an organization, and whether it's any of the people here at the panel, you have an opportunity to help meet that need and really make an impact on people's lives. So as far as maybe just 2 quick projects that I've been privileged to be part of. One is there is a real shortage of healthcare workers right now, especially RNs. And as you look at the labor trends with the baby boomers retiring and the aging individuals we have in America, there are not going to be enough nurses here in the US no matter what we do. And so a number of years ago, we started an international recruiting venture with a consultant that we use. And so we have gone overseas and recruited nurses overseas and helped them get their permanent immigrant visa to be able to come here to the United States and be a nurse here in the US. So what's been exciting about that is that certainly has been a wonderful solution to some of the labor challenges that we have faced in recruiting nurses. But it's also been a really exciting way to make a life-changing difference and provide a great opportunity for families and individuals who have wanted to come to the US and be able to have a life and a career that is much different than they could have maybe in a third world country or where they're currently living. So that's been one more HR specific experience, more medically related because we do have our own pharmacy. I think the most recent thing that comes to mind is we've been involved in doing lots and lots of COVID vaccinating. We have actually turned our home office where all of our offices are and so forth into a vaccine clinic. And so we have done vaccine clinics probably once a week to do dose 1 and dose 2 of various vaccines, usually Pfizer and Moderna. And we will put anywhere between 1,200 and 2,000 people through our office in a day to vaccinate them. And to hear people's stories has been just incredibly moving. One that comes to mind is someone who came through. It was a family member of a resident who said that they had just been diagnosed with a terminal disease and they had been given about 6 to 12 months to live. And because they had been able to get the vaccine, this would enable them to go and see their family members, which with much lower risk to be able to make those connections and say their goodbyes. So, that was just incredibly moving to know that we could be part, whether you were in, HR and standing at the door helping direct people or somebody actually giving the vaccinations, a way to make a difference in that sense.
Angela, I have a follow-up question. Which countries are you most heavily recruiting your RNs from?
Right now, we are recruiting from United Arab Emirates in that area. Most of the nurses who are there are from the Philippines, but that is a English-speaking country with very westernized medicine. And so by the time the nurses get there, they have had a chance to experience both of those things and to successfully transition to another culture. We do sometimes recruit directly from the Philippines, but we have a little quicker path when we recruit those nurses. We're actually now getting into the early stages of doing some recruiting of nurses from Zambia and other African countries who have just limited access to the ability to do the testing and things that they need to get their nursing license that is internationally approved. And so we are working with them to immigrate as a nursing assistant and fill those needs that they have, and then have access here in the United States to further their education, to further improve their English, to further increase their technical skills to be able to then eventually become a nurse as well. So.
Fascinating. Thank you.
Mhm.
Rob, I can't wait to hear about a couple of projects you've enjoyed working on.
Try to think about how to describe some of the products because they seem abstract. So I work in a division of Boston Scientific where we do cardiac care devices, so implantable pacemakers and defibrillators. We have Medtronic, one of our main competitor, who is the dominant player in town, had developed several years ago a very small pacemaker that's just about the size, smaller than a AAA battery, that just is implanted completely within the heart. No external wires or leads or anything like that. And we've developed something similar. But one of the things that we have done with our approach is we have what we call a subcutaneous defibrillator. Most defibrillators are implanted below the clavicle, and they have wires that run inside the heart to be able to monitor the heart's activity and be able to either pace it if it's running slow, or to shock it if it's running too fast, and basically reset it. We have a defibrillator product, though, that's implanted below the armpit and actually runs outside the rib cage and sits underneath the skin there with the wire, so that there's nothing touching the heart. And if you look broadly in our industry, when wires are inside the heart, because the heart's beating, thousands of times a day, those wires can break down over time, and that becomes a problem. So you're benefiting the patient, but also putting them at risk over a period of 10 years. And so we have this product that has an external wire and nothing touching the heart. Well, what we've done is we've actually combined together that leadless pacemaker that's inside the heart and the external defibrillator that sits outside the rib cage, and we've coordinated them together so they actually communicate with each other and coordinate care. And that's actually the first time that that's ever been done in any med tech industry, where you've got two different devices that are each independently providing therapy for the patient, but also working together as a coordinated system. And so our division is called CRM, or cardiac rhythm management. And so we branded that MCRM, or modular cardiac rhythm management, which is more in line with precision medicine. You can provide a patient only what they need, only when they need it. So we're beginning clinical trials here probably in the next month or so of that system. And that's been several years in development. When we first brought this to the FDA, they didn't even know what to do with it, because they're like, this has never been done before. You've got two different devices that work as a coordinated system. And so it's all been brand new. It's been pretty cool to be part of that, to be part of even some of the first concepts in the labs, just experimenting with that. Does it work? And being able to see sort of that eureka moment, watching the lab monitors, like, wow, this is actually working. We can see evidence of the devices communicating. So there's some really technical stuff that's pretty cool. But the other piece that I think is really cool from the products or the projects is sometimes it's just the branding and the naming of something. Because if you can tell a good story about something, it changes the way that people think about it. And so with our subcutaneous ICD, our SICD product, when we first acquired that technology from a startup company back in 2012, we acquired the startup company, and we started working on that, and I branded it the Emblem SICD. So if you look up the Emblem device with Boston Scientific, you will see like all of that, the Emblem MRI, that entire portfolio. That was my branding project. But then it's sometimes even just the feature names. And we had a feature that we developed, a new algorithm update. And based upon the description of it, I called it the Smart Pass algorithm. And that little phrase right now, if you go to just Medline or PubMed and do a search on clinical trials, everybody's using that name right there. They're saying, oh, the Emblem SICD with the Smart Pass update is providing outstanding care for patients. And so that's pretty satisfying as well, because it is how people grasp what it is that we're talking about. It's the technology, but it's also the story that you tell that people hold on to. And so that's as cool as the technology sometimes, I think.
Wow. Rob, I'm so glad you teach marketing at Bethel.
I'm enjoying it. Thank you. I'm glad for the opportunity too.
Anila, tell us some good stories.
Yeah, so really only have the one product that I've ever fully developed. I actually have here, this is the first version of the device, which came out in 2017 and took us about about 2015, so about 2 years to really get to market after all the different iterations. And we went to HAX, which is a hardware accelerator program based in Shenzhen, China, that really was that extension of our four-person co-founding team at the time to help us with the industrial design, the mechanical engineering, the hardware engineering. And then Keen 2, which is the name of the bracelet because it brings you keen awareness. Keen 2 is coming out right now. We're in pre-order and starting to ship our first units. Is based on 3 years of customer feedback, as well as our NIH research grant with a renowned trichotillomania researcher, where we've actually answered the question of, okay, I'm aware that my hands are not doing something I want them to be doing, now what? And so integrating habit reversal training, which is one of the gold standard treatments for these mental health conditions, into the bracelet, as well as a completely new mobile app system. So that's the product that I've been working on since 2014, since my husband grabbed my hand and I resisted the urge to punch him in the face for telling me I can't pull out my hair. Which, thankful for it, because it set us down this path of innovation, of doing things we never would have thought we'd be doing, like Rob said, naming things. And it's not like I studied how to do branding or naming. We just sort of riffed on words until we found things we liked, and it was just fun processes. But that's what we're working on, and just helping people build awareness of where their hands are and allowing them to use that vibration as that cue to change behavior.
To me, it looks a little bit like a Fitbit, and I'm wondering, do you like it when people say that, or does
It
that annoy
was,
you?
no, it was very much intentional because
Okay.
people don't want to talk about these conditions. And that's something that's changing. That's something that I've seen since starting, and now the normalization that I think we've been a part of shifting that shame that I felt. For 20 years I hid, right? I didn't want anyone to know that I was pulling out my hair. Because of the way, even how I said it, I was pulling out my hair, right? I am assigning blame. I am assigning guilt. But someone with diabetes doesn't say, I'm not processing sugar, right? It's, they detach from it, but they can learn to manage it. And that's what we try to teach people, is you can learn to manage with awareness and making new choices and changing lifestyle. So yeah, the Fitbit comparison, very much so something we wanted to keep discreet for people. That was actually a few of the things that customers asked for, was that, can you put a screen on it so that I can tell the time, so I don't have to be wearing that and another wearable. And step tracking was the other thing. So now they can use our device, where we're positioning it not so much as, here's your step tracker, count your steps, but more so as a strategy to calm your hands, move your feet.
Well, I think it's a beautiful product. Does it come in several colors, and do you have different versions for children and adults and men and women, or?
Yeah. Well, our original version comes in a bunch of different colors. I can actually grab our stand of all the different versions if you guys want to see it. This is kind of an evolution of the products. So this was the first device that I wore as when I was testing. So it's just a yellow slap bracelet from arts and crafts store. And then these were all the colors that were in market. And then Keen 2 just comes in charcoal, like a dark gray, and the lilac that I'm wearing. So just try to slim down the SKUs because small team.
Thank you for showing them to us. They're beautiful. Christy, what would you like to add? I can't wait to hear.
I just think it's fascinating to compare and contrast the Boston Scientific behemoth to the Anila, shop. But I think the importance here is to tell people, like, healthcare is that big and that accessible and that I don't know if the word desperate for disruption is the right word, but that people who have a solution and an idea can contribute. Anila is solving real problems for real people that healthcare has had a hard time addressing. And I would just encourage people, do you have an idea? You're in the right place to try to make an impact there. So I love hearing this and comparing and contrasting these things. But specifically, I think the project, so answering your question about interesting healthcare related projects I've worked on, I feel like I've done several. So my entire career, as I shared it with you earlier, I was the first person ever to have that job title in those places that I went. I was the first person to build an injury prevention program at children's hospitals and clinics when we pursued level 1 trauma designation. I was the first person to start our first ever telemedicine program at children's hospitals and clinics. And so I think the thing, again, that is so intriguing about healthcare is it is a space in need of innovation, and it's constantly innovating and evolving. And so the opportunity is just, it means that no job will ever be the same. Even payment models are changing, and accountable care organizations, and how, you know, product companies are billing for services and engaging directly with customers, whereas maybe before they engaged through the healthcare provider. So I think, you know, to answer your question directly, the building a telemedicine program to enable kids anywhere to access pediatric care, that was interesting. Maybe just to provide a little bit more context there, we had an emergency, a pediatric emergency focus. So we wanted kiddos in northern Minnesota where there were no, let alone physicians, they weren't pediatric focused. And when kids are in crisis, they need specific care. And we enabled that virtual connection to rural Minnesota physicians to be able to access pediatric emergency physicians whenever they needed it. So the joy, you know, and we all look for meaning in our work, and I will never, you know, be qualified to put a Band-Aid on a patient because I'm not a clinical provider. I can feel satisfied at the end of the day that I enabled a kiddo somewhere to get the care they needed when they needed it. And I think that's what I've heard throughout all of these too, is that patient connection and the connection to the mission, which is not hard to find in healthcare. You can easily find that connection.